And thank you, Alyssa. I wanted to introduce Alyssa Harris, who is a licensed master social worker. She is the community engagement and partnership coordinator with the VA healthcare system in Ann Arbor. And she has quickly become a friend to our county and is available for trainings and a lot of enthusiasm and energy to the work she does. So welcome, Alyssa.
Thank you. Thank you so much for having me. I really do enjoy doing trainings with groups and being in an interactive space. So I love that you're all on camera, especially for a training like this. This is a heavy training. We're going to be talking about suicide today. And so having folks on camera so I can kind of gauge where people are at is helpful, but also just be mindful of taking care of yourself as we go through this heavy topic. And if you do need to step away for a few minutes, go off camera, have some water, just kind of reset, please just take a moment now to kind of check in with yourself and see where you're at today. And if you do need to step away, this material will be here for you if you want to come back to it at a later time. I do have my contact information here. You're welcome to contact me about anything you want. I get all sorts of random email questions and phone calls all the time. If you have a veteran you're working with or a suicide prevention question about anything, you're always welcome to contact me. There are no silly questions. So I'm going to be covering quite a bit of ground today, talking a little bit about suicide prevention overall, lethal means safety, risk mitigation strategies, and some resources that we can all utilize in our practice. I am going to try to be really fancy here and stop sharing this screen and actually load a video. I have two videos that I like to share when I do present, and let me just see if it will allow me to pull that video up. I think it's a good one, if I can do it. All right, are you able to see my video? Yes, okay. Now the question is, will you be able to hear my video? Can you hear it? Can I get a thumbs up?
Oh, never mind, I can't hear it.
Okay, and now of course it's like letting me hear it, but okay. So is there a secret to screen sharing with audio on here?
When you click to screen share, the buttons at the bottom left should say share system sound or share audio.
Yes, I see it. Thank you.
You're welcome.
Okay. Excellent. Oh, no. I'm so sorry you're recording this and I'm being a hot mess over here. All right, screen share, share sound. There we go. This is gonna work this time. It will be worth it. Okay.
I'm good, but I feel alone in a crowd.
I'm good, but nobody understands.
I'm good, but the past keeps coming back.
But I can't get out of bed.
And I can't sleep.
I'm good. I feel overwhelmed.
I'm good, but I don't feel safe.
But I don't even know who I am anymore.
But I still have nightmares. But I don't need any help.
I'm good, but I don't feel anything anymore.
I'm good, but I can't live like this anymore.
I'm really not so good. But are you ready to listen?
All right, I'm gonna pull up. Are you still able to see my screen here? Oh, it's gonna play another video. Okay. Okay. Can you see my presentation
We can.
screen? Okay. So I like to start with that video because I think that it's really important to recognize that as a culture and society, we don't really take the time to really pay attention and listen to each other. Now, you all are clinicians and helping professions, and so you have a different threshold and way of talking to people where you really genuinely do care. When you're asking like, how are you? You're not just like, oh, I'm good, like, and moving on. But it is really important to take that time, you know, in our personal lives and in our professional lives to really remind ourselves that, you know, people do just have this expectation of saying like, I'm good and moving it along. It's just how we talk in our society. It's like asking, how are you doing? It's just, that's how you introduce yourself. And so it's really taking that extra step of paying attention to a person where they're at as the starting point and really focusing in on how we can really listen and be there for someone. So to start this training on lethal means safety, I really have to start at the beginning, which is just like a real broad suicide prevention overview, which I know most of you are pretty familiar with. But suicide is a national problem, and it's such a big problem because it's a preventable cause of death. And I think that's why we're all here at the, you know, for those of us who participate in the Hancock County Suicide Prevention Coalition, because we all believe and know that suicide is preventable, and that with looking at different evidence-based strategies, we really can reach our most vulnerable populations and make a difference in helping people in their lives. I do come from the VA, so on a couple of these slides, you will see some information about veterans. And there is a reason that we talk about veterans when we talk about suicide prevention, and that's because veterans do die at a higher rate of suicide than their civilian counterparts, which I'll show just one slide of data on in the next slide. But one thing that I always like to talk about when I'm talking about suicide is that suicide doesn't just impact the person who's dying, it also impacts the surviving people, both in their lives, but also people who didn't even know the person. If you think about celebrities that you've heard about have died by suicide, when someone dies by suicide, it gives us pause to think about that person in their life and how they got to that point. So there's some research that was conducted, and it really does show that about 135 people are impacted for every life lost to suicide. So this impacts all of us. And I would hazard to guess that everyone on this call has known someone to die by suicide in their life and have been impacted in some way. And there are different populations that are at higher risk for suicide. And so I talked about veterans. There's also folks who have different economic disparities, race, ethnicity, LGBT all plays a role, homelessness, social connection and isolation all play a role in where a person is at in terms of thinking about suicide. Here's some data. Again, I didn't do data heavy on this, so I'm just going to go through a couple data slides. I do see that I have like a number 2 on the chat here, so I am not going to be able to read the chat while I'm presenting. And so if you do have a question or comment, please do just raise your hand or unmute, because I will be able to respond to you more easily. I can look at the chat after I finish presenting. Did anyone have questions from the chat?
That is me sharing
the
slides to everybody, so don't worry about it.
Okay, good, cool, thanks.
Okay, we'll stop you if there's questions, Alyssa.
Sounds
in
great.
The chat. Yeah,
perfect. All right, so yep, so looking, this is, I always, like I said, want to touch on veterans because this is showing the higher line is the veteran suicide rate from 2001 to 2019, and then the civilian rate is underneath there. And you can see both were rising up until 2018 to 2019, which both populations did have the civilian population a slight downward trend, and the veteran population about 343 less suicides in that year. The data you'll notice says through 2019, if you're a data geek like I am, you know that data is always 3 years behind because the reporting mechanisms have to go up through CDC and get audited and come back down. This is my last veteran data slide, just a little bit more information as to why we're talking about that. Some data points, this was specifically from the 2022 report, which was really looking at 2019 and 2020. So veteran suicide rates for all races decreased from 2019 to 2020. But one of the findings that was really a big difference this last year was that suicide's the second leading cause of death for veterans ages 18 to 44. And the reason that that's so important is because that's a time frame when a lot of veterans are transitioning out of service. And so it really highlights that those younger veterans who are transitioning out of service are a really high risk group. The other key point that I just want to talk about, we don't have to go through all of these because you can clearly read these, is the method. And that's because today we're talking about lethal means safety. And in 2020, 71% of veteran suicide deaths were by firearm. And for US adults, that rate is usually about 50%. And so we're going to be spending quite a bit of our time today talking about firearms as we talk about lethal means safety. I thought folks may be interested in Ohio specific data, so I did pull a slide from Ohio, and just very similar to the national average for civilians, for suicide rates in Ohio, firearms were the leading cause of suicide at 51, almost 52%. They have kind of an other category, which is the second highest. As a Suicide Prevention Coalition, we wanted to explore that more. We could learn a little bit more about that, and then they separate out overdose as well. So you heard this in the video. VA has this perspective that suicide prevention is everyone's business. And I definitely share that view that we all have a role to play no matter what hat we wear. Whether we're grocery shopping as a citizen in our community, whether we're a licensed clinician, we all talk to people in our day-to-day lives. So we all have an opportunity to save someone's life when we're talking to them. Margaret, I see you have your hand up.
I just wanted to, the slide before this in the other category, can you give me some ideas as to what type of suicides would fall in that?
Yeah, that could be things like hanging, jumping off of a bridge or something like that. It can be poison outside of overdose. So usually it's things like hanging or jumping.
Okay.
Yeah.
Thank you.
Yeah. All right. So I want to introduce lethal means safety counseling, which again, this is my last video. So I'm going to pull that up because this is going to give kind of like a general overview of what we're going to be talking about for the rest of our time. And I think they do a nice job of talking about this in this video, and then we're going to deep dive into these areas.
Social service provider. You interact with veterans every day. A veteran in your care could be at risk for suicide, but you can help keep veterans safe. The most important thing to know is that suicidal crises are usually brief and temporary. To keep someone safe during a time of crisis, help put time and space between them and lethal means, such as poison or firearms. Firearms are the most lethal method of attempting suicide. In fact, nearly 90% of firearm-related suicide attempts are fatal, compared with just 5% of all other suicide attempts. And nearly 70% of veteran suicides are by firearm. So as a provider, how can you help? You can ask the question, are you having thoughts of suicide? Have you thought about what actions you'd take to die by suicide? If, after a thorough screening, the veteran does not appear to need immediate emergency services, help them make a safety plan, a list of coping strategies and sources of support they can use during a crisis. Make sure the plan addresses how the veteran's access to lethal means will be limited. 90% of those who survive a suicide attempt do not go on to die by suicide later. Every veteran suicide is a tragedy, and even one is too many. When we help put time and space between at-risk veterans and lethal means, we can save a life. Learn more about how you can be there for the veterans in your care.
So again, we're going to really deep dive into this now and talk really in depth about what is lethal means safety and some strategies, lots of strategies. So just like the slide, the video just said, lethal means can be anything. They are objects that are used for self-harm. So there are certain means that are used more frequently, like firearms and medications. Those are like the two leading causes of suicide. But anything can be used for self-directed violence. And so when we're talking to folks about suicide, if they are talking to you about thoughts of suicide, again, this conversation is going to really happen if we're asking that question, are you thinking about suicide? And the answer is yes. Then we go on to have this lethal means safety conversation. And we don't want to assume that it is going to be a firearm or medications. We do want to ask that question, how are you thinking about killing yourself? And really trying to identify what their plan is, if they have a plan, and then finding ways that we can reduce that risk that they're going to use those means to harm themselves. So I know we're like a little like veteran heavy. That video is veterans. This is for everyone, but yeah, like approximately 2/3 of veterans who do die by suicide do die as a result of firearms, and half of the civilian population is dying by suicide that way. And those who are living in rural areas are actually at higher risk for using firearms as a means of suicide. So, you know, Hancock County has Findlay, which is a more populous area, and then it does have a lot of surrounding rural areas. And a lot of efforts do get targeted towards like larger cities and populations, but we do really want to be mindful of our rural surrounding areas, because those are usually the more under-resourced areas where folks may struggle accessing care or accessing social support or their basic needs for getting through their day-to-day. So it is really important that as a community that we're looking at everyone, especially those in those rural areas, because they are at a higher risk of dying by suicide and by firearm. So we did go through some stats in the video. Really, to me, it's pretty groundbreaking to like hear that 90% of firearm related attempts result in death, while 5% of all other attempts combined result in death. And I think that's important when we think about like the suicide rate and how people are dying, because there are so many more suicide attempts for completions. And so folks are not necessarily dying from a suicide attempt, and then 90% of those are going on to get help and treatment and are not dying by suicide. But for those who are using firearms, it is the most lethal. You can't unfire a firearm. And so those are resulting in death more often than other types of attempts. So this is the probably most important slide, and if you take away anything, I hope you take away this, which is that most suicidal crises, the actual point of I am going to go kill myself is about 1 hour. And so if you don't know how to do anything with the person sitting in front of you, just sitting with them for 1 hour is doing a great deal, because even though someone might be thinking about suicide for a length of time, that acute crisis is 1 hour when they are going to say, I am going to go do this. And it really makes a difference to have strategies that the person can utilize when they are within that 1 hour time frame, because if they can get through that and not have access to that means in that 1 hour, they are more likely to survive and go on to get treatment or to move away from that thought, because they've gone through this crisis moment and now they have moved out of it. And so we're going to talk a lot about that, but really the takeaway is we want to create time and space between a person and the way that they want to die, because if we can create an hour of space, or at least try to extend it as much as possible, then it's less likely that they will act on that thought that they want to attempt. So when we talk about these strategies, a lot of the strategies we're going to talk about are going to be ways to create time and space between a person and their way to die. And we know it works. So that's the thing, right? Is, you know, like when we get into these conversations, it's like, how can you really show that creating time and space matters, or how can you really measure that with the research? And there have been quite a few studies that have actually looked at lethal means safety. And one of the most interesting recent ones was looking at the Israeli Defense Force. The Israeli Defense Force had a really high suicide rate, and they're younger folks who were carrying firearms, and there were a large amount of firearm suicides on the base. And they decided to do one strategy, just one. And what they did was they said on the weekends, all firearms had to be locked up. People could not have access to their firearms on the weekends. That's the only thing they changed. And the suicide rate dropped by 40% on the weekends. And it maintained that the whole time that they kept that in place. And that was the only strategy. And it didn't change during the week when they had access to it, which really showcased that not having that access in that time really allowed people to not attempt suicide. And there was a very similar study in the United Kingdom in the 70s, where they were using coal ovens, and people were using these coal ovens to die by suicide. And people came together and decided, we're going to do away with these coal ovens and change them out. And just by changing out the ovens, the suicide rate dropped 43%. And what it also shows is people don't go on to find another way to die. People really have in mind how they're going to attempt suicide. And if they don't have access to that way, they are not going to find a different method. They're just choosing not to do it. And so that really highlights how important lethal means discussions are, because if we can try to create that time and space between a person and their means when they're in crisis, that can save lives. Any questions kind of about lethal means safety, how it works or why it's effective before I go on to talking about some specific types of risk mitigation? All right. So we're going to talk about firearms, and I just want to acknowledge up front that this can be like some people are like, oh, she's going to talk about firearms and like not having access to firearms, and it can be quickly co-opted into like thinking that this is like a rights conversation, and it's not at all. Again, I want to highlight that lethal means safety is a voluntary choice to understand you are in a time of crisis and you want to create time and space of at 1 hour between yourself and your means. And we're only talking about firearms because we know it's the leading cause of suicidal death. So this is an ad from VA, no one can unfire a firearm, and it shows a firearm with a cable lock. And so, you know, oftentimes I'm like driving around and I carry cases of gun locks in my car. So one practice that we as a community can do is really trying to promote and provide these gun locks, because folks can actually, if they're in a time of crisis, they can actually put a gun lock, cable lock on their firearm. And a best practice would be to also take that key, and if they're in a time of crisis, to give that key to a loved one to hold on to for, you know, a brief period of time. Or they can even freeze that key in an ice tray so that they have to take that extra time to thaw it or chip it out. Again, getting creative here with creating time and space. Try to get that 1 hour of space. So some facts about firearms. And again, I got some veteran information here, but half of veterans own at least one firearm. On average, a veteran owns 6, and 1/3 store at least one firearm loaded and unlocked, which means that they have access to it. And I heard a really great presentation from West Virginia, where they have just a totally different firearm culture down there. And they had a great campaign that was talking about, like, we understand that people are using firearms to protect themselves, but who's protecting you from you when you are your greatest risk? And so it's really having that conversation with people that sometimes these are helpful tools, and sometimes we are the risk to ourselves. And just to kind of take away some stigma about firearms, there are a lot of research around this as well. Are people who live in homes with guns more likely to have experienced a mental health problem? No. Seriously considered suicide? No. Attempted suicide? No. So just because someone has firearms doesn't mean they're at higher risk for suicide. That is not true at all. It just means that people with access to firearms may use those firearms if they are in a suicidal crisis. So I always want to make sure we don't debunk that. The other really great, this is actually a national best practice, and it's being discussed across just a variety of platforms right now, and that's called out-of-home storage or temporary storage, safe storage. It goes by kind of a variety of names. And every state has different gun laws, you know, so that's a big piece of it when talking to firearms dealers. But one of the kind of groundbreaking best practices that's emerging right now is this temporary off-site safe storage, where, say, think about like a shooting range or a firearms dealer, someone who's already very comfortable and familiar with accessing firearms and giving and selling. They could purchase a firearms locker and design a program where individuals can come in and check out their firearms, no questions asked. and all the staff are trained in suicide prevention. They have those resources available. And it's not just for suicide prevention. It could also be you have family coming in from out of town and you don't want them to have access to that firearm. Or maybe you're going out of town and you don't want to leave your firearm in the home. I just had a situation a couple weeks ago where a veteran was homeless and he wasn't able to bring his firearm to the shelter, and he was looking, where can I put this temporarily? Because different states have different gun laws. You can't just hand your firearm to somebody in a lot of places. So this is one of those groundbreaking strategies. Hold My Guns is a nonprofit that's national, that's kind of leading the charge on this. And if you look up holdmyguns.org, you can find all of the offsite storage in your community. And what you'll find is that there is very few. Yeah. So this is something that is kind of a newer, groundbreaking thing that if you have interest in, definitely reach out to me and let me know, because it's something I have a lot of interest in trying to build in local communities. So we talked a little bit about that. Some other ways to do safe storage, though, would be to take the firearm apart, to give the ammunition to a friend or family member, to put the firearm in a gun safe. And then I have a picture to kind of go along with this. So we have a lot of different options, really. The cable locks I have access to like in abundance. And so if anyone wants to order those, I can have them mailed to you in the cases by the 100. So, feel free to email me or call me if you want to not purchase, but get them for free to hand out to people, and by the 100. Trigger locks are also popular, but they are difficult to install, and there have been some accidental firearm shots that have happened as a result of trying to install the trigger lock. So VA actually does not recommend using those, but it is an option that some people do use. There are lock boxes in gun cases, and then the life jacket. And the life jacket actually has a company, I'm forgetting the name of it now, but it's a nonprofit group where you can actually have like a skin made over the life jacket that you can put like a picture of your family or like a slogan that kind of helps you remind yourself like why you're living, so that if you see it, it kind of is that additional reminder of, why you don't want to use it against yourself. So I'm teaching you all this with the hope that you're going to take this information and have conversations with people, right, about firearms and lethal means safety when you're encountering someone who's in suicidal crisis. And you do want to take into account some things when you're having this conversation with folks. And the first thing you really want to think about is, what is your comfort level with talking about firearms? Because if you're very uncomfortable talking about firearms, it can be more of a negative conversation. So you may want to actually practice a little bit before having this conversation with someone. And one big thing with that is that language does matter. So firearms is kind of like that standard key terminology. Weapons, if you say weapons, that can have a negative connotation. So folks might not be very receptive to using the term weapon. You also just might want to think about your relationship with the person. Is this someone you're meeting in the ER for the first time, and it's going to feel to the person like you're trying to take away their firearms? So you really want to think about how you want to have this conversation with the person so that they are really understanding what you're talking about. We're really just trying to create time and space between you and this way of dying. And we do have some suggestions of things you can say. So again, I want to make sure you have access to these slides so that you can look back at this and practice this a little bit if you'd like. So you can ask them, like, how are you currently storing your firearms or medications? Do you have concerns about storing them more safely? Do you have anyone you can hand the keys to a cable lock if you were going through a time of crisis? How can you keep yourself safe from substances that could make things worse? So there's a variety of types of questions you can ask that are open-ended that just get that conversation going to try to understand where the person's at and what they're thinking about. We do have a tool that was created with the American Foundation of Suicide Prevention and the National I can never say this, Shooting Sports Foundation. And it's a toolkit for firearm storage in your community. So if you'd like to order some of those, I can order those for you. And again, it's talking a lot about the types of things we're talking about today, strategies for safe storage, for firearm safety when someone's in crisis. Okay, I'm going to switch gears now and talk about medications. Are there any questions about firearms before I move into medications? Okay.
I'm sorry, I'm trying to unmute myself faster.
Yeah.
I was just wondering is there any correlation to the use of alcohol?
With firearms or with suicide in general?
With firearms and suicide.
Yes. So I think I have a slide about it. You're getting a little ahead of me here. I think
no problem.
I think it's in this presentation, and I think I have it in the medication section. And yes, let me I think it's right here.
No worries, you don't have to go far. We'll get there.
Okay, yes, there is a correlation with substances and suicide, and I'm going to touch on it. Thank you. All right, other questions? All right. So opioids and risks. So when we're talking about overdose, it can be overdosing on a variety of different types of medications, but the leading cause of suicide death is opioid overdose. And so I just wanted to have a slide to just talk a little bit about opioids. So one thing is just that natural opioids have the same risks as those made in a lab. So when I'm talking about opioids, I'm talking about heroin, I'm talking about street fentanyl, car fentanyl, I'm talking about prescribed opioids from a doctor. They all carry that same level of risk. And the biggest risk in terms of opioid use is actually when someone has stopped or decreased their opioids and then begins to take them again. And often if they begin to take them again, they take them at the dosage that they were previously taking them. And that is what creates an overdose in most cases, because their body has lost that ability to handle that level of opioid. And now they've overdosed. So it's really important that folks know that they have that information. If you are stopping or decreasing the amount of opioids you're using, and you do decide to start using it again, you have to start at that lower dose, because otherwise you're going to have an accidental overdose potentially. And it's very dangerous for folks to use opioids alone, because there's no one around to be able to help the person if they do overdose. And that's why it's so important that folks do have Narcan and things like that available, which we'll talk a little bit about. And mixing opioids with alcohol and other substances can also cause an overdose as well. So I just wanted to talk a little bit about that. A few more things. So an overdose happens when a person takes more opioids than the body can handle. And some of the signs of that would be difficulty breathing, slowed breathing, and then in some cases, death. We talked a little bit about the tapering already. Okay, so the question about the intersection of substance use and suicide. So there is an intersection of substance use and suicide. And it's interesting because in a lot of trainings I've been to, they talk about one of the leading causes of suicide is untreated or undertreated depression. And while that's true, it is also true actually that using opioids is actually the highest risk of suicide. So and that's something that I hadn't really heard too much about until I actually did some research on that. And if you look at the graph on the right here, you can actually see that intersection of suicide with opioid use is really high, followed by folks who have a diagnosis of bipolar disorder. Those are the folks that are at highest risk for suicide, are those combinations. A few more stats about substance use and suicide. So 100 times more likely to die by drug overdose in the next year if someone had been admitted to the ER for an opioid overdose. And if someone had been admitted for an opioid overdose, they're 18 times more likely to die by suicide compared to the general population. Really just highlighting how serious opioid use disorder is, not just for the accidental overdose piece and the quality of life piece, but also putting folks really at high risk for suicide. So with that, we do have a lot of strategies for medication safety. Some pictures here on the right, medication disposal bins that can be placed amongst and around different counties. In my experience, I have seen most of these disposal bins that get purchased by counties, like in the police department, which makes sense because people get a little nervous about having medication stolen, so they want to have it in a safe place where people are unlikely to go through and steal the medications out of the bin. But also not the greatest place if you're just like a citizen who doesn't really want to go to the police station, especially to like go turn in old opioids. So it's a little bit problematic and underutilized because of that. But also they're available more recently in a lot of pharmacies. Not every pharmacy, and again, it's something that can be encouraged to different pharmacies to have access to medication disposal. It makes a lot of sense, right? Bring your old meds in, come get your new meds. So those med disposal bins are great. There are also doTERRA bags, there's different brands, but doTERRA is the one I'm most familiar with, which is where you have a baggie and you pour your old medications in, pour water in, shake them up, and it's environmentally friendly. You can then throw it in the garbage. They dissolve, and they're safe to throw in the trash. The VA also has a program with med disposal where veterans can get an envelope. They can put their old meds in the envelope, put it in the mailbox, and it gets sent to an incinerator. So those are available to remove medications, unused, unneeded medications from the home. I've even seen communities provide information on this to funeral homes and hospice to be able to teach the community and the families like, hey, does your loved one who recently passed have excess medications? Let us help you know how to get rid of them to reduce the risk that they're utilized by someone else. Blister packing is also something that we can encourage pharmacies and prescribers to put in an order for bubble packing medications that may be at risk for overdose. Again, time and space, right? We're trying to create time and space between a person and their means. So if they have to go through every bubble, it creates a little bit more time and makes it a little bit more difficult for them to take that time to really think about, is this what I really want to do? For those, I don't know how many prescribers I have on the call or folks who have conversations about refills with their patients, but I also think it's really important to kind of understand like a differential diagnosis of what's really going on here. If you have a person coming to you and saying, I need more refills sooner. I think that we can get really caught up in this idea like this medication's being misused if you're asking for a refill sooner. But we really do want to understand what's going on because that will tailor our response. Is it that the person is misusing it? Is someone in their household misusing it? Is it that they have really poor symptom control, or is it they're trying to get high? Because if it's poor symptom control, then maybe we really need to be talking to them about alternatives like holistic health treatments, or we need to talk about and understand better what their pain level really is. Maybe they're just not understanding the instructions. So as prescribers, having these open-ended conversations, have you noticed you're needing refills sooner? What is going on that you feel like you need refills sooner? To try to really understand so that we can provide some guidance about what they can do. So the next piece is going to be talking about some life-saving treatments like Narcan and naloxone, which depending on where you live in the community can be a very controversial topic. I've worked with communities that really believe in and love naloxone and really go above and beyond to provide it to all the residents. I've worked with communities who said, we will have nothing to do with Narcan. So, it's tough because it's a very stigmatizing, for whatever reason, it's very stigmatizing. The perspective on it is, you're saving someone's life who's overdosing. You could save a life, right? And then the person then can go on to get treatment and recovery. And we know that if it is a suicide attempt, 90% of folks who attempt to die by suicide don't go on to die by suicide. And so we do have this ability to, all of us, carry Narcan on ourselves so that if we do encounter someone dying by an overdose, we can help them. I have actually had this happen very randomly, about 10 years ago, I was driving past McDonald's and there was somebody unconscious and people were surrounding them, and I was able to resuscitate them and give them Narcan, and the ambulance arrived and they survived. You never know when something really random is going to happen. And if we all have the ability to carry Narcan and make sure that folks who are prescribed an opioid and their loved ones who live with them have the Narcan and know how to use it, that we provide all the people in the household with that training, we're more likely to save lives. Another controversial risk mitigation strategy is drug testing kits. So in San Francisco, they did a pilot with the VA, and actually this is now more available to local communities and counties. And these are fentanyl test kits where someone can actually take a medication that they purchased and test it to see if there are other things in it outside of fentanyl. And if there is, then they can make that choice of whether they actually want to take that drug or not. And what they found was actually that people used substances less when they did find that there were other things mixed with their drugs. It did not increase their drug use, it actually decreased it because it gave them more motivation not to use. So those are things that different communities are trying as a way to have harm reduction strategies in their local community. Questions about medication-based overdose. The other thing that I find interesting about overdose is that, you know, every community has different ways that they screen for things. And so when we looked at the suicide rate and we saw what it was for Ohio, I haven't talked to EMS or the medical examiner specifically about overdose, but some communities, when someone overdoses, they do actually do like a deep dive screening to see if it was a suicide attempt, and some places don't. And so that's the other key thing to keep in mind. And the other key thing to keep in mind is that that 5% of all other methods result in suicide. So there are more people attempting to die by suicide via medications, likely, that are not completing suicide, that could then really benefit from some additional treatment, outreach options for risk mitigation moving forward. Okay, our last area that we're going to talk about, and I just have the one slide or maybe two slides, is suffocation. And this is really a difficult one because anything can be used as a way to die, right? So it could be with suffocation of rope, it could be a belt. There's so many different things. And so it's hard to, if you're doing risk mitigation, removing these items from the home, obviously that is going to be the number one thing you can do. Is if someone's talking about hanging, suffocation, trying to remove those things from the home. But it is one of those things that if someone is talking about suffocation, that they really need to be hospitalized, right? Anytime someone's talking about, I have a plan, I'm going to kill myself, we want to make sure that they're being screened in the emergency department. But then when they're, as part of their safety plan, coming back out, we do want to try to remove as many of these dangerous items when they're in that crisis state as we can. And so just some information about that is, with hanging, most of these occur within the person's home. It is the second most common method for suicide for male veterans. And it is challenging because there's so many items that can be used. So you do want to really have a deep depth conversation with the person as part of their safety planning about what are some potential items you're thinking about that we can remove from your home to make your home more safe. What can you do with those items? Can you give them to someone until you're feeling more like yourself again? So again, safety planning is going to be really key. And then also really trying to work with natural supports for any of these methods, but especially for hanging. If the person's living with someone or they have a close friend that you can talk to and have them actually go with the person to help them remove these items from the home, keeping them with that person really would be crucial to making sure that that person is able to be safe at their home. All right, so now what can we do with all of this? All right, so this is like my call to action slide, right? So hopefully you're going to be able to use this information in your day-to-day practice. But if you really wanted to do more with this, some additional things that you can do would be to maybe develop some relationships with some of the firearm dealer and groups in town to see if they'd be open to developing safe storage, to be getting copies of the toolkit from the National Shooting Sports Foundation, to be able to have those conversations, finding places for safe storage in the community, talking to folks about it. And then there are some additional trainings available. If you like this training, there is a 2-hour CALM training, counseling on access to lethal means. That is very similar to this. It's just 2 hours. And you can access that for free at the website, which you'll have access to these slides, so you can click that link if you'd like. There's also gatekeeper suicide prevention trainings that you can attend to better have. This is kind of like the part 2, right? The part 1 is the QPR question, persuade, refer, or VA save, signs of suicide, ask the question, validate, expedite treatment. So this is kind of where you're already seeing that the person's suicidal and having this conversation. If you feel like you need to back up to be comfortable asking, are you thinking about suicide? Those types of training are available also. Just a couple, I wanted to give an example. I worked with this coalition, Prevention Works, in Hillsdale County, Michigan. And there's so many things we can do as a community, as a group, coming together to build strategies. We actually developed these lethal means safety toolkits where we put in there a deterra bag, Narcan, a medication box, a crisis line card, a gun lock, and then some brochures about firearm safety and medication safety. And we actually provided these kits to the emergency department, to the inpatient units, to the pharmacies, DHS, the EMS, police, and they actually are distributing these kits to folks that they're seeing that are at risk for suicide or overdose. So there's so many things we can do, and this is just one example of something we can do as a community to help support the people and reach the people who we might not be seeing. There's also, I don't know if anyone's seen any billboards. These are coming from the national office. I've seen several of these. This is in Texas, but I actually saw one in Michigan recently. Together we can prevent suicide, store your firearms responsibly. This is from Project Child Safe and VA and the National Shooting Sports Foundation. And then I've also seen another one from End Family Fire, where they're talking about firearm safety as well. So these billboards have been popping up around town. I don't know if anyone's seen any. So another way to do that. And then some resources for you all. Again, I talked about the suicide prevention training, a little bit more information about that, and the CALM training, and there's some information about that. I have about 1 million of these brochures, reducing firearm and other household safety risks. It's just like 2 pages. It looks like it's bigger, but it's 2 pages. And if anyone wants copies of that to hand out to folks, I'm happy to give you those. And then 988. So I think at this point, most of us are familiar, but we did change our national crisis line number. We do have that 800 number still active. People can still call that. They will get help. But we also have a new number, 988. And then if they served in the military, they can press 1. But 988 is for everyone. And so really getting the word out about 24/7 help, getting screened, talking to a licensed clinician through 988. There's also this online training network called Train, where you can get a number of free trainings, a lot of them with CEs. This is sponsored by VA, but it's for non-VA healthcare professionals if you want to receive a number of additional trainings on evidence-based therapies. And that is it for my presentation. I wanted to allow for some time here at the end for Q&A. I know I covered a lot of different ground around some different topics. Go ahead, Dan.
Hey, good morning. Nice presentation. Hey, question. I know we're trying to target like gun sales and stuff. Has anybody thought about approaching gun manufacturers and putting pamphlets or something in the boxes of the guns that we're purchasing, and something we can put on along with gun manufacturers, gun safes? Anything that we can put that and give them free information and just put and make it big and huge so people can actually see it when they open that box.
I love that. Dan, come to the Suicide Prevention Coalition and let's start a initiative.
I do come to those. I do come
Yes,
to those.
good. I don't see you. I can't see your face. No, that's a
Yeah.
great idea. I love that. And I haven't heard anybody talking about that. That's a new one.
That's all.
I like it.
Other questions for Alyssa? I will mention, oh, Melissa, did you have some questions? I will mention that we do have the opportunity and have been doing the overdose review here in our community, and we'll be starting the suicide reviews next month. So, and I don't know the exact number, but we exceed that national average in terms of the use of guns as the means for suicide death.
We are a rural
Dan, I'm
community.
going to put you on mute. You're still unmuted. Maybe if I can find you on here. Oh, thank you. Other questions?
I have a question for Alyssa, just because I'm very naive to guns and stuff. I'm just really curious, how much does a gun lock or the sleeve or anything, how much do those cost?
So I get the cable locks for free from the VA. So I don't have a price point because I do have free access to those. Sorry, my husband. I would have to look and see how much those cost.
Okay, I was just curious if it was a deterrent or anything to people actually getting one. Okay, thank you.
Yeah.
Now, on that gun lock cable, I know Mossberg's big in it, and I think about all manufacturers, when you do open up that box, there is a cable lock that comes with them, typically. New purchases, anyway.
And with that, I was actually, I had developed a nice relationship with a firearm dealer in Jackson County, Lead Bunker, and they have a new program now where anytime that someone purchases a firearm from them, they give them like a little VA swag bag, whether they served or not, and it has the gun lock, that brochure that I showed you, the Reducing Firearm and Other Hazards, crisis line cards, materials like that, to provide to anyone purchasing a firearm from them. So I love the manufacturer idea, and there are some things like that that could be built at the community level too.
So I think that would be a good conversation for our suicide coalition to discuss the next time we meet, is if we want to do some of those reducing lethal means toolkits and what we would want to include in that. But I hear loud and clear you have plenty. So if our emergency room wanted to pass them out, or our police, or even like QRT, our harm reduction team, any of those, so we could have those available. Mark, were you going to ask a question? I think you unmuted.
I was going to ask a question, Alyssa. You know, a lot of this was specifically on, you know, if a person's in crisis and that hour and that type of thing. I can really appreciate that. But how as coalition can we more educate the community before there's a crisis? I don't think people understand that, you know, over 50% of firearm deaths are by suicide. And then you see the numbers by suicide when you use a firearm. How can we make, it seems like something people just don't want to talk about. It goes back to, you know, maybe gun control and that type of thing, which we're not looking for, but just to make people aware of loved ones that have guns and that, or firearms, that, you know, what to look for as a general public knowledge.
Yeah, I really value QPR and VA SAVE training. Those are suicide prevention gatekeeper trainings that are specifically for community members rather than clinicians. So this training today is really kind of like clinician focused. But QPR and VA SAVE is really designed to teach everyday people, just like CPR, right? If you get CPR training and you see someone unconscious at the grocery store, you have a skill set to go and just you keep them alive until the help arrives, until the professionals arrive. So the QPR and VA Save is designed to teach people, here are the signs of suicide to look for. If the person is talking about XYZ, if you're noticing these particular signs, here is how you ask them about it. And so I think really trying to bring that gatekeeper training to really large, like when I say large groups, I mean all different types of groups. Doing a training like that for a business, for a restaurant, for grocery store staff, for anyone in the community, for schools, for teachers, anyone. Because then the more people who are trained in it, just like CPR, the more people you have trained in CPR, the more likely someone can respond in a time that someone needs it. But then I think it's also like the upstream approach to suicide prevention, right? Firearm safety is for everyone, right? So Project Child Safe is not about suicide prevention. It's about safety when you have a child in the home, making sure firearms are locked so that children don't access them. Because those numbers are just looking at suicide deaths. We're not looking at accidental discharges. We're not looking at children accessing firearms. So I think that approaching it broadly creates more dialogue around safety in general. And I think most firearm dealers and shooting ranges share that hope that people are using firearms safely and responsibly. And I think it's about getting a little creative with integrating that into some things that maybe already exist also. Like, for example, in Hillsdale County, they're having a safety fair. And I heard that they were having a safety fair. And so I went and I attended the meeting, and they're talking about like having stop, drop, and roll and stranger danger and, you know, those types of things. And I was like, can we also have a booth on firearm safety? And they're like, we never thought about that. That's what I think about immediately. But so I think it's also integrating into things that already exist, going to different groups to train them, bringing this awareness to places. We're not creating our own space and asking people to come to us for it. If we can find ways to do outreach creatively, I think we can integrate these ideas.
Just to share, Alyssa and Mark, so we currently have two QPR trainers through the previous suicide prevention grant with Sergeant Mike Cortez and Maggie Brown at Family Resource Center. My kit I got the notice that mine got shipped on Friday. So once it arrives, I do the 14 hours, I'll be QPR trained too to add to the adult prevention that we're offering in the community. And we still have Working Minds, which goes into workplaces about suicide prevention. It's been changed to Vital Cog is its new name. But that's on the menu of options when we speak with employers and we speak with organizations that are asking me to come out and speak, that's something that's available.
And then another thing I was just thinking too, I think another really untapped area to do outreach where there's a very specific population who could be reached is through faith-based groups. If we could get SAVE training and lethal means training to a bunch of different pastors, clergy, chaplains, they see a group that may not be coming in seeking mental health treatment as their first line of defense when something goes wrong. And if we can get them the training and how to connect them to help, that is a really untapped area in most places.
That's great. Some conversations directly to me in the chat. Brittany Nye, who's our coordinator for the OFR and the SFR, shared that 57% of completed suicides in 2015 through 2022 were firearms, and in 22, 86% were firearms.
Wow, that's really on the rise.
Yeah. And Dan is full of some additional great suggestions. He recommended reaching out to gun clubs and conservation clubs, as well as the Ohio Department of Natural Resources regarding hunter safety, to put that in their training. So Dan, those are great ideas. And I think we'll bring those forth to our next suicide coalition meeting on March 27th from 11 to 12. And if anyone is on this training that's not part of that and would like to be part of that coalition, just put your name in the chat and I'll make sure you get the invitation for that.
And I just put my email in the chat again, just in case anyone has any follow-up questions, or if you want to order any materials, just reach out and I'm happy to help you.
Yeah. Any final questions for Alyssa? Or she did say, I want to honor, we said we wanted to keep it to an hour for people because we know people's time is precious now, but she did indicate she could stay on a little longer if people had additional questions, but kind of a last call before we say goodbye for questions in this first hour. Okay, thank you so much, Alyssa. Again, she'll stay on if anybody wants to stay on and ask some additional questions, but thank you so much. And Alyssa does attend our Suicide Coalition meetings as well, so thank you.
Thank you so much for having me. And I will hang out if people want to ask more.